still are now. We actually started implementing the guidance straight away from May 2022. So prior to that, since then, all advice and support and guidance became universally available to schools at no charge from that summer term. We decided that we'd already made changes because we felt that changes had to be incorporated into how we approached our schools, how we supported our schools from March 2020. So since the pandemic hit, we felt we needed to make changes with the partial school closures. So by summer of 2022, we felt, let's just keep rolling, let's keep going with the changes, let's not try and go back and restart. So prior to March 2020, we were a legal enforcement only service with traded elements for training, consultation and audit. And 2 years later, we were providing training, advice, consultation, everything free to our schools. We were asked to give you sort of some brief context about our authority. So I've pinched something from what we call our Norfolk profile, just to give you a flavour of what Norfolk is like. Unfortunately, it's not always such a rosy picture. Our achievement is not good, particularly with our early years attainment. It's not always in line with the national averages, and there's some big gaps between Norfolk and national. And it starts to appear from year one and just grows throughout the primary phase. Key stage 2 attainment is amongst the lowest in the country, unfortunately, and this attainment gap at age 11 results is lower outcomes as well for secondary. We know, and as you will know, that reduces our opportunities for our post-16 cohort, and therefore can impact them for the rest of their lives. So gaps in attainment between groups are similar to national, but the impact of underachievement is more significant for disadvantaged students here in Norfolk too. And attainment in the smaller schools is consistently lower than for larger schools, and disadvantaged gaps are wider. We also have issues within our schools with the level of challenging behaviour and attendance in all of our education settings, and unfortunately this has increased year on year. Attendance rates declined significantly following the return of all children to school in autumn 2020, and they do remain concerning. Our persistent absence rates have been above the national average at secondary for a number of years, and our suspension and exclusion rates in Norfolk in our primary schools are higher than national as well. The use of exclusion has risen sharply in the last 2 terms, and most secondary schools in Norfolk exclude 1 or more pupils each year. So we have problems that we're aware of that we are trying to tackle across the board. We have a wide range of structures in our school system. Half of our primary schools and all but one of our secondary schools are academies. Almost all are in multi-academy trusts, the majority of which are Norfolk rather than national academy trusts. And there's been a significant increase in schools belonging to MATs in Norfolk, but unfortunately, as of yet, that's not resulted in an overall improvement for our outcomes across Norfolk. So our breakdown for that 441, we have 19 schools that are independent out of that bulk. 2 of our schools are all the way through. We have 51 secondary schools with 349 primary schools and 15 special schools. 38 academy trusts operate across Norfolk, which incorporates 246 of our schools. But we do still have a core 173 primaries that are still LA maintained. So as you can imagine, that's quite a changeable landscape to work with when it comes to our schools. So what have we done? So live data, or data project, our live data project, and I'm sure you guys have been trying to get data in for years too. Ours has been going on for the last 5 to 6 years, and it's fair to say that it's had successes as much as its failures. Just this side of Christmas, we have finally got data coming in, which, as you can imagine, is really positive. But we've also been working alongside, obviously, the DfE's project with live data, as we are part of the LA Critical Partner Group for that as well. So now we feel like we're going to have lots of data to tell us what we need to do. And then we need to work out what we do with it. But for us, with data, because it has been such a problem, we've had to find different ways around it of how to communicate with our schools and how to communicate with our colleagues. It was a sort of a silver lining of COVID and having to change the way that we worked, that we started to look far more at our vulnerable cohort of pupils, particularly children with a social worker. We started to create lists by comparing what was held on our social care system, which is the Liquid Logic database, compared to our education system, which we use Synergy here in Norfolk. And our data boards were able to match up lists across the two boards to be able to produce a list for us that during the pandemic we shared every week with our schools and asked them to complete and return to us, so we knew exactly which of our vulnerable children who came under that bracket of a children with a social worker were in school. And we did that on a weekly basis while the schools were partially closed. So what has happened since then is we've been able to continue sending that list out. Thankfully for me, that responsibility shifted away from my small team over to a different area of children's services, but our schools still get that data sheet every single week, so they're fully aware of all of the children who are on their school roll who are open to a social worker, and that list provides them contact details and what category that they're in, whether they're with children in need, whether they're open to child protection. Also gives them the name of the social worker allocated, and also links them back to us if they need to discuss any concerns around attendance with those particular children. So that goes out every week. Since we started our Norfolk attendance strategy, we have had different work streams operating, and I'll talk a bit more about that in a second. But one of the things that we did with regards to data is we actually held a workshop with schools. So we invited representatives from different schools. As you just heard, we've got a wide range. We had people from academies, we had those from little tiny maintained primary schools. We had trust representatives, and we brought them all together for an afternoon to discuss what data they had access to and what was their wish list for data too. And that has allowed us to take forward designing a dashboard that will hopefully soon be able to actually work with the live data that we're getting in to be able to sort of share back with them. It also stops us going to them asking for different data requests for various reasons. You know, small things such as when we go to court, we no longer need to ask the school for an attendance certificate because we'll be able to access it ourselves. Now, we've been able to get our live data project working because we've actually gone through a different system called the group called XVault reporting, which means we're going to have our own access to sort of our own version of a management information system that will allow us to pull reports. And like I said, it's really exciting here at the moment because we come and see all these possibilities that we're going to be able to do with this data now that we have access to it. I mentioned that we're part of the LA Critical Partner Group for the DfE data collection. So we're actually using both forms of collecting that data in and being able to compare it, while also trying to persuade any outlying schools who still haven't signed up for either reporting system to make sure that we're getting that full picture from all of our schools. We've also made sure over the last few years that we are as best informed as possible regarding part-time timetables. We've had a new service created since last summer called our Schools and Communities teams, and they have been working with us to be able to monitor part-time timetables, particularly when there's new and emerging SEND need in particular. We then still pick up the bulk of those, but we ask schools to inform us which pupils are on part-time timetables so that we can go back to them and get that feedback as to why they think it's appropriate for them to be on a part-time timetable. We monitor it and we go back to them with advice of whether we think it's appropriate or not. I've already mentioned our Norfolk attendance strategy. Attendance is everyone's business. This is broken down into 4 key priorities. They are relationships and communication, effective intervention, systems and data, and workforce development. Our work streams and strategic board for the attendance strategy has been operating now since July 2020. with the strategy formally launched in February 23. And that included a briefing about the strategy and a discussion exercise for professionals to undertake. So we recorded like a video like we're doing today, and then had an MS form attached to the end, and it was sent out via all our internal communications and to our partners to in your team meetings, can you please have a look at this and complete the MS form afterwards? And we asked them questions around further training, their understanding of attendance, so we could get that all fed back into the strategy. We held engagement events with professionals across the safeguarding partnership, including with representatives from the voluntary and community sector. We visited the NSEP Trainers Forum and the local safeguarding children groups. The work streams and the board are made up from representatives across NCC Children's Services and from other partners such as the voluntary and community sector and health. As part of some of the work ongoing in the work streams, an e-learning was also developed and launched as part of our induction, and now forms part of the CBD package for all staff who come into Norfolk County Council. So they learn about the attendance strategy for Norfolk as soon as they start work now. We've also worked in consultation with children and young people via the Youth Advisory Board and through pilot work in a large secondary school. And over the summer holidays, we launched in conjunction with Health a parent and carer survey regarding school attendance via our Just One Norfolk pages, of which the results were used to inform an attendance campaign launched with schools across the NCC. So we've had our attendance campaign running since September. So today I was able to send out a communication to link in not only ours, but also the national one that's just been released by the DfE too. With regards to who's been involved, we have loads of different partners involved. We've had Sue Smith, who's an assistant director for our service, sit as the chair. So our strategic board is chaired by an assistant director. But in addition to that, we have a project manager who keeps us on track. We have assistant directors of learning and achievement from children's social care. We have SEND operations. We have youth offending team. We have lots of representatives from health. We have people who are involved with comms, with training, all across the board. And I think the buy-in from our children's services leadership who have seen it as a priority, has been a real bonus. If you go, oh, you might be on my next slide. Sorry, I'm probably behind. So how do we communicate with schools? So I'm really proud that my team have built really good relationships with all of our schools. And we know that they value it because they fed it back to Ofsted on our behalf, which is really nice of them. So we do lots of different things, from start of year calls where the team contact all the schools to make sure they're really clear about how things are going to operate this year. We operate a duty service, so they can call us Monday to Friday during term time, email us, we get back to them straight away. I always have 2 officers allocated to that every single day. We communicate with them regularly through what we call management information sheets that go out centrally. We have a website, and I've put a QR code on the slide so you can actually access that if you'd like to have a look at any of the things I'm talking about today. It's totally open for people to access. Like I said, we provide all of our training and services to schools universally, so why not share best practice with everyone? We have really successful county-wide network meetings, so all schools are invited to come and participate. We do them once a term, and we'll have a range of key speakers come and speak to them, as well as covering best practice topics. I always ask 2 to 3 schools, each one, to come and share something that they do well within school, so they can share it amongst their colleagues. We also do district networks as well, so not just the county-wide ones, but district ones. We've run a series of webcasts over the last few years to talk about key topics with our schools, anything from admissions through to medical needs, anything that comes up that they tell us is a problem or they want more information about. We seek out to work with that other team so that we can share that information across. We've collated an attendance network directory so we can email out, training offers. If we want to contact them directly, we've got that link there straight away. And like I said, we offer all our training to them for free as well. So our targeting support meetings, we've actually been running these since September 22. 2022, we do these virtually, so we offer them out to schools. Last year was our first year. I had an AEO allocate to each district in Norfolk, and there's 7 districts in total, and I left it to them to talk to their different districts to work out who, you know, when they're going to have those meetings. This year we've moved it on a bit and we've got a little bit more militant with it. We've offered out as a central invite, so I emailed all of the schools and we sent it via the MI sheets to tell schools, do you want a termly target and support meeting? Please contact us, and they've got booked in. We allow for about an hour for a primary school and up to 2 to 3 hours for a secondary school. So we have them pre-planned out in our team diary. And essentially, I have an AEO allocated each day to cover TSMs, and whichever's booked in that day is their responsibility to do. We have a pro forma that they complete throughout the year, so it doesn't matter who picks it up because it's completed and saved in our central folders, and the school keeps a copy of it. And they seem to be working well. We've had feedback after the first year, so we've adapted some of the things, including we've adapted to include some more data now about children with a social worker. But we've also made sure that we're not just sort of gathering data for the sake of gathering data. What we're gathering, we're helping schools to look at that whole management of what they're doing, so they can target their resources as best as possible. So I asked my team for some feedback on how they think TSMs are going. And I've put one of their quotes up on the screen, but they came back and said it helps them identify schools who are reluctant to engage with them. It gives schools the confidence to tackle attendance. They felt it supports schools to feel more confident with challenging parents and being professionally curious, which links into practice and learning from serious case reviews. They felt it gave schools, particularly primaries, a forum to share their creative engagement ideas that we can then disseminate to other schools, and it allowed schools dedicated time to discuss attendance strategies and sharing best practice examples. So they feel that they've been really positive. It's also allowed us to make sure we've got links in with other academy trusts who might have been a little bit more avoidant of working with us previously, as well as staff within our own organisation, particularly our senior advisors for alternative provision. She links in with us really closely to make sure that we do our TSMs in conjunction with her reviews, which she has to do as part of her role. Last slide, please.
We've just got a minute or two left, Katie, not to put you off, but just quick on the last one. Thank you.
No, that's fine. I'll be really quick. So just to cover that, here in Norfolk, we already had an approach where schools do their supportive work first. We've always been really clear they have to evidence that support first before they move on to legal intervention. And then we as a team pick it up from the point of them sort of completing. We still use the terminology fast track. So they complete that case management and pass it to us and we prosecute it in court. So for us, that kind of that feed through from working together wasn't new. It was just reinforcing what we've always been told. And I'll just pick up that a couple of things that we've achieved is around with our strategy. We've done a staged intervention pathway for promoting good school attendance, which has been successful, and I can send a link for that too. And the last thing is for our work with the virtual school, who have been part of our strategy all the way through too. They have reps on our boards, but we have also now got a linked attendance entitlement officer with the virtual schools. They've essentially seconded a member of my team who is now doing joint up work with the virtual school, which is really positive. So sorry, I've gone over time. I do.
No, that's fine. That's perfect. So much lovely and really important information there, Katie. And hopefully everybody, as I say, whatever the context is, will have seen something there. And I think one of the things that worried a lot of people was, how do I do this with a very small team? I've got a very small team in a large number of schools. Hopefully you've given some sort of confidence there to them in what can be achieved when you have got a fixed number of members of staff and have to do the best you can with what you've got. I suppose a question for me, and then I'll see if there's any questions from the virtual room, but a question for me really is, I joined one of your targeting support meetings in a school outside Great Yarmouth, and really good to see that relationship building between the school and local authority for the first time in many cases, and they found the session really useful. But a bit people have worried about is will schools want the talent support meetings, particularly will independent schools want to be part of this conversation? Do you want to say a little bit about? I know you've touched on the feedback, but a little bit on what you found from the sort of take up.
Yeah, I probably do have those numbers, but I skipped over them for my
Oh, that's all
time.
right.
Yeah, we've had lots of take up to the point
Yeah.
where like I had to sort of say, oh, we're getting to saturation levels of how many want us sort of per term.
Yeah.
So in for our first year, we completed only 170 SMs in the autumn term, 195 in the spring term, and 239 in the summer term. So it went up each term in that first year we did them, totaling 541 across the year. And we've already, I think, exceeded that from what we've done already in the autumn term. I can't see that figure straight away, but
No,
it's
that's fine.
definitely increased.
The key takeaway is that people wanted it, didn't they? And when you went in and you had the conversation, they saw the benefit of that conversation. And certainly the one I sat in on, they found the note taking and the sort of collaboration around individual cases particularly helpful. And as you mentioned, the sort of document so that everybody who picks up cases know what was agreed in one central place, basically was what I took from that session. Any other questions or thoughts for Katie from anyone in the virtual room? Oh, I might get to ask my second question then, Katie, if nobody's forthcoming. No, go on, Anita. I'll let you ask one.
Sorry, Adam.
All right.
I can never stay quiet in these meetings. So I just wanted to kind of jump in on what Katie said about she's obviously got somebody that's seconded out of her team into the virtual school, just to kind of give colleagues in the virtual room an idea of what we've done here in Essex, which is similar but slightly different. We've used virtual school funding to employ 2 new people into my team on a 1-year fixed term basis at the moment, where essentially where we can see that there's any historic social care background for a child who's been referred in for prosecution, which obviously my team would be dealing with, we won't necessarily straight away go forward with that prosecution on the basis of the school. So we will then put in some quite intensive support where somebody essentially gets alongside the family, gets to know them, tries to figure out what the barriers might be, uses that toolkit that you obviously mentioned, the Let's Talk, We Miss You, if that's not already been used by the schools, just to try and figure out what it is that the family might need. The other thing that we're looking to do particularly is try to avoid the prosecutions. One of the things that we've learned in the autumn term that we've had this running is that some of the cases that have been referred to prosecution, we've really quickly identified that they're definitely not appropriate for prosecution. There's definitely a lot more work that needs to happen for some of those families. So we're able to go back to the school and say, we're not willing to take this forward on a prosecution, but also give them a lot of guidance as to what does need to happen to support those families and hopefully improve attendance in a different way. So that's been quite useful. And as I say, we're a massive local authority, lots and lots of schools, lots and lots of pupils. But that's been a real good use of that money. Just as well, if you don't mind, just really quickly, so what we were figuring out was under the Supporting Families programme, there were lots of team around the family meetings that schools were calling team around the family meetings, which actually were doubling up as school-based meetings to discuss attendance. So we've also developed a tool by which we can collate that and gather that information from schools. So they just fill a very quick online form in to tell us that they're holding one of these meetings. What we're trying to do with that information is to gather who they're calling. So are they health colleagues? Are they who are they that they're having to call in to bring that multi-agency approach? And that's helping us then to obviously use our resources differently and identify where there might be some gaps and things like that in resources that schools might need access to.
That's a really helpful point. Thanks, Anita, because the people missed a bit this in the guidance, I think, a little bit. Certainly I've seen when I've had conversations being out and about, but the guidance is really clear. If there are existing meetings that are happening, particularly sort of team around the school, team around the family type conversations, use and repurpose some of that, build on that. Don't feel like you need to invent something new in every space if that is there. So yeah, that's a helpful point. Thanks for raising it. I'm coming to you in 1 second, Millie, but I'm going to sneak my last question in. Sorry, Katie. It's on another bit that people feel a little bit worried about or have sort of struggled with in some areas, and that is just on engaging sort of senior leaders and the sort of engagement of social care more generally. You spoke a little bit about that, but just in terms of the how for people, you went about that. If others on the call are struggling with it.
No, it's fine. I think it's probably down to, and I won't take the credit, but my line manager who is quite tenacious with that sort of thing. And fortunately for us, the spotlight that the pandemic kind of shone on attendance, both sort of locally and nationally, helped. And like I said, it's not a rosy picture in Norfolk with our attendance figures, and it hasn't been before or after. So actually we were able to kind of pick up on that. But the actual moving to working from home for a lot of us and working remotely meant we connected with each other far better. So actually I now work with teams and managers and assistant directors who I would never have come in contact with when I worked in an office, and that actually benefited us. So it meant that people started to know what you did. You know, we weren't just this obscure little team sat somewhere in an office in Norwich. You know, we were actually out there talking to people all the time. So we were able, through our sort of assistant director who sits on the strategy chair, to sort of make sure that other directors were involved. And like I said, our execs, Sarah Tough, you know, really brought into the fact that attendance needed to be highlighted. So that, alongside our NSCP sort of chair as well, they launched the strategy and they made it, you know, you have to do this in your team meeting, you have to look at this, you know. So it wasn't just us as a team, you know, my 8 officers ringing up social workers and going, why have you closed this case when the attendance is still bad? You know, it was coming from all areas. We've got the principal social worker involved. I've been out and, you know, we talk at people's team meetings all the time. It's about really getting out there, shouting about it, and making sure most people want to be involved. Most people understand how important it is. So it's been good, but it is about kind of, I suppose, not backing down and just keep on at it. That, I think that's how it's felt the last couple of years.
Lovely, thanks, Kate. So I suppose the tips for people sitting there thinking, how do I replicate that? It's getting into the right conversations that I can get into and keep trying ones, even if the door's closed a little bit, by being tenacious. It's being really clear on the ask and how they can help you, rather than just saying, here's a shared problem, how can they work with you?
We're also very big
at
on
all levels.
Offering it out as well, like, oh, if you're struggling with attendance, why don't you come and talk to us? So we set up what we call the attendance surgery. So every week, without fail, it's happening now, 2:30 till 3:30. One member of my team is sat there available for anyone inside NCC or out, as not schools, but like a professional who want to come and talk about a case of concern. They can come and talk to us. So it was about kind of us getting out there, like we kind of promoted ourselves by going to these different events, going to different team meetings, you know, just constantly talking about why it is that, what that link is between attendance and safeguarding, and promoting what we did too, offering help out, you know, not just asking for things, but just, I don't know, being busybodies ourselves about it, I suppose.
Super. Thank you so much, Katie. Thank you for being so honest, open, sharing so freely with everybody. Loads of really, really hard work gone on, I know, for you and the whole team. And thank you for everything you're doing. Finally, we're coming to you, Millie. Sorry, getting too excited with the questions. Welcome on behalf of Cambridgeshire County Council, and over to you.
Millie, I think you're on mute.
Excellent.
And I was too. I was saying that, and I was on mute.
Excellent. Thank you for spotting that. Okay, so you can see here we've got around about 84,870. That's a breakdown that you can see here for our schools. What's interesting about Cambridgeshire is it's quite large in terms of it's got rural sides, and it takes a long time for us to travel from one school to the other. We've got an interesting context here for ourselves in the sense of what challenges are experienced in the city is very, very different to what you'll find in our rural areas. And that seems to be where a lot of our challenges are, and where we needed to have a service level offer that really met the needs of the cohorts that served each of these different schools. You'll see the size of our team there is not particularly large, in the sense of the size of the team you can see actually oversee everything to do with attendance, including all legal court work. We oversee EHE, CME, children in employment and children in entertainment, just with that staff that you can see there. So in terms of wider context of the situation, we have 15.8% of children are registered as EAL and 21.3% are on free school meals. So we have quite high levels of poverty in terms of in the city, and needing to have schools that think very creatively about how it is that they can support the young people they're serving, and that does certainly extend into rural areas as well. Now, prior to us actually commencing with the new duty, we got started in about September 2022. Prior to that, we've already undertook significant change within our service and our offer to schools. So fast forwarding sort of about 4 years ago, we were very much inside schools. We were heavily seen. We would visit many of our schools on a weekly, fortnightly basis. Lots of cups of tea, biscuits and chats about very specific young people. And we recognised then that actually what we were creating is a culture of we'll come in and we'll do lots and lots for you. And we weren't actually developing the level of skill or knowledge within those schools. So prior to the duty, we already had started changing our model, which was to come out of schools a bit more, but actually have a better emphasis on the communication that we give them and the support that we gave them. When this new duty came out, it was like a light bulb, like, right, we can connect all of these things together. So what we did is we had to convert to being a virtual service, as we recognised our vision could not happen if we were in cars and travelling from one school to the other. We're too big and there's too many miles in between. For us to convert successfully into a virtual offer, we faced many challenges, and that actually came from schools resisting this change. They wanted us to be back in schools. They missed that cup of tea and a chit chat about the odd severely PA pupil. So we needed to apply quite a lot of theory. We used Cotter's 8-step theory for change in a bid to actually get our team to invest in this change of being a virtual service, get senior leadership involved, but also our schools, help them recognise what they are going to get in exchange of you altering your service level offer to meet this need and this new duty. We found that to be very successful in the sense of actually they were understanding now what they can get. And when you've toppled that with the new duty as well, it enabled them to say, well, actually, I've got to undertake all of these things and I don't possess the skills or knowledge to do that properly. And we're saying that's okay. This change in being a virtual service means we can support you better to do that. So actually, we had much better collaborative working from our schools who embraced this change of being a virtual service, as they saw what they got in exchange was far higher and they were in a much better position to meet this new duty. So it was certainly very positive. Next slide, please. Okay, so as you can imagine, our service level offer is entirely free for all of our schools. That includes the independent sector as well. It has been free for them for a number of years now. But part of this and our weakness that we noticed when we read this new duty was our use of data. Now, we already had it, and we'd already signed up to WAND, and we had really good success rates from our schools, but about 98% of a sign-up rate now. That includes in the independent sector as well. But actually what we needed to do is look at our data in a very different way in order for us to prioritise and see which schools perhaps needed that increased support from what we were currently offering. With that, we created a data dashboard. So we actually have 2 members of our attendance improvement officers that went on to an apprenticeship scheme in data analysis. They go on to help deliver training, but go on to help us as well produce data dashboards. That means that we can see all referrals coming in, going out, interactions and level of engagements for all of our schools. And we can share that with senior leadership as well. That dashboard is also seen by multi-academy trusts. So we can say to them, look, you can see that schools within your trust are not actually engaging with us as regularly as they did before. Or actually, look, we're not getting enough deletion from roll forms. Are you actually properly articulating that to us? Are you following due process? It gave us a means to see who perhaps should not be doing the number of referrals they should for the cohort they're serving. It enables us to prioritise them better, but actually have data and facts to be able to present to executives of large multi-academy trusts and professionally challenge them on their lack of collaborative working, or actually where they clearly were not following due process. We have lots of multi-agency schools discussions. And we collect our data from that. So it's lots of multi-professionals that participate as well. That helps us pick up any poor practice that might be going on, any concerns from other professionals. And we're using that to think about actually what's going in for our schools already. So that helps us to tweak our service level offer, particularly to geographical areas by using the data dashboard as well. But picking up from police what's potentially happening with high levels of truancy or exploitation as well. We analyse our free school meals and young carers data. We recognised after the pandemic that our young carers almost doubled here in Cambridgeshire, unfortunately. So we use the data from lots of our vulnerable groups in order to actually tackle brand new projects and new ways of working. So we have currently projects with public health, we've got projects with young carers, we've got projects with our military covenant, we've got quite a few large bases. And we use those projects and that data from that in order to shape our service level offer. And already we're seeing very strong success, particularly surrounding our young carers. We've delivered training to all of our services within the Education Directorate and external agencies based on this new duty, but more importantly, how it is that they can actually work collaboratively with us. What we do, what we offer, what we expect from our schools that they can professionally challenge, but also that they can say to us what school is particularly struggling or who may need actually increased support. Like I've mentioned, we have lots of ongoing projects, particularly with the police at the moment. Unfortunately, we have quite high numbers of young people at risk of exploitation and county lines. And so we continue to work with the police to make sure that we're being really hot on truancy. We are into position as well where our officers are now certified by the police to conduct truancy sweeps without our police actually being present with us. And we have appropriate identifications to conduct those. So we're really hopeful that by the time we get to summer, when that's been finalised, we will be able to offer far more in-depth truancy sweeps, which will be reducing our exploitation rate, particularly for those that are commuting to London for the exchange of drugs. Next slide, please. Excellent, thank you. So our communication with schools, we recognise that the needs of our schools varied considerably, particularly when we're thinking about our change model that we implemented. Our little primary schools truly missed that cup of tea and a chat. Our secondary schools were far more embracing of it. Every secondary school that we have here in Cambridgeshire is an academy. So we felt that that also made quite a significant difference towards those that embrace this change. What we offer in terms of communication is our yearly meet and greet, and that is something that we have face-to-face, and we offer 3 of those, so all the schools can get together and meet us. And that we find is often our carrot. That helped with that change management that we talked about, because we said to them, you're not losing us completely, you will still have interaction face-to-face with us, and this is your opportunity to do that. We also offer virtual termly cluster meetings for our schools as well, and that's very much based on having guest speakers, gives them a chance to do work out in the breakout rooms where we have sort of working and team building exercises for them, sharings of good practice. We use a half-termly newsletter, and we use that to update our attendance officers on relevant things we feel will be useful. That's updates on admissions, so they're very aware of their off-rolling and on-rolling. Then we have links as well, information from our military covenants, so they're aware of frequent movements, and from our young carers and so on. So again, what we're doing for them is we're training them to think outside of barriers that could be affecting attendance. So we're asking the attendance officers to gain that knowledge and experience in other barriers that could affect a young person actually arriving in school in the first place. And that newsletter and that cluster meetings continues that training and development for them. They've accessed Monday to Friday for free the non-school attendance helpline, which is overseen by an attendance improvement officer. They get a same-day response, but that NSA helpline is also widely used by professionals both inside and outside the local authority. So we're contacted by GP surgeries for queries of medical needs or barriers to attendance. They could be from police, from all over the place, to be honest, tend to contact us for any queries surrounding attendance, children employment and so on. And that has been very helpful. Just last academic year, we had just around about 1,800 inquiries last academic year using that specific NSA helpline. We have an online portal for schools and professionals as well, alongside our YouTube channel. So that's where they're able to access any forms of guidance, any templates, any webinars or recordings that support them in terms of with their training. We've got a Learn Together webpage as well, and that's got all of their information about what is good practice, some examples from some other local authorities, examples from other schools as well. And it's a really good sort of hub and portal of knowledge for them, because we can link in constantly to all of these other projects. We might be saying about a young carer query, we'll be saying, okay, that's great, but have you registered? Or do you know what the young carers offers are? So every time they link into them, it will take them to the appropriate sections as well. Because very much our ethos all of the time for our schools is to continue with their professional development. Next slide, please. Okay, so our target support meetings, we have, again, a nice sign-up rate for those. So they are virtual. Every school's offered 1 per term, and so far we have quite a strong success rate. Now, the reason why we felt that schools signed up to this a lot more is because we were very clear about what it is that they would receive in exchange. It is not to criticise in any shape or form. So they are with the officer for an hour and a half, give or take, depending on the size of the school or the level of their need. An officer is given 1 hour prior to that appointment to read all attendance policies, information online, conduct their data analysis and do a full scope of the school's needs, barriers and referral rates. That means that when they go into that meeting, they're fully prepared to support that school. Their main aim is to ascertain working practice. So they'll say to the school, give us an example of your last CME, when you made a last CME referral. This isn't for us to pick holes, this is for us to identify the development need, because that officer then can make recommendations on how they can develop better practice, or whether or not that officer in that school feels comfortable and confident with that particular aspect. What we do is provide reassurance when they don't, and we explain to them where they can access their free webinars, free sways, and how they can access our YouTube channel for full information and guidance. Again, training them to develop their practice within their school, providing that support. We assist them with their data analysis as well, help them to fully identify their data. That is one of our biggest weaknesses in our schools in Cambridgeshire last year, is that they have their data, they can look at it, but can they really interpret it in a meaningful way that will enable them to make strategic decisions? And this aspect really helps them with that. What we also do is we do a little dip testing, because you can talk the talk, but do you actually put it into practice? So what we do is, using Wand, we can dip test names and we can say, okay, tell us about such and such. What was this young person's journey? How did you arrive at this point? It's not to catch our schools out, but it's to make sure that what they talk about with their policies and processes in schools, they actually implement in a timely manner. And again, helping them to identify areas of improvement. We also offer a solution-focused approach for improving attendance as well. That's all young people that they are concerned about, and they're severely PA young people. And by that, we help them to consider other referrals, barriers to accessing attendance, and just general approaches they can have. And then we take those details of those young people and we reach out to those that are involved and articulate the advice and guidance we gave to schools as well, to make sure that we're evidencing collaborative working. Next slide, please. Okay, so last slide from me. This is with regards to working with families. So again, what we've said before, it's very much about training our schools, supporting our schools to develop good practice. And by that, we are very, very strict into what we expect our schools to do before we will consider legal sanctions, okay? They must ensure that they have offered an early help assessment to a young family. And again, they must provide us with evidence that they've conducted that work. We have a thorough checklist of early help interventions that we expect our schools to have explored or attempted previously. What we don't want to see is I sent a letter or I just had a meeting. We're looking for creative approaches that removes barriers to engagement. That could be through interpreters, that could be through the letters that they're using, it could be leaflets, information and guidance they're providing. So to give you an example, all of the letters our schools send should have a QR code from the local authority. That shows when scanned by a phone of the owner, it will interpret the guidance into the language of that owner. And actually that comes through directly to Cambridgeshire County Council's website, where we in fact are reiterating what the school is doing and saying. And that's because we're trying to show very much a united front with all of our schools. Okay, so parents can scan that and see it's not the schools bullying them. The local authority mirrors what that school is saying, and it's interpreted within their language, which we've found been very useful, particularly in some of our rural areas. An attendance service representative at all multi-agency meetings and virtual school social care. So we make sure that there is attendance representatives at all meetings that exist for those as well, continuously advocating for the use of the attendance service and methods and toolkits. And that came very much because prior to the pandemic, you may have found some professionals were very reluctant to engage the attendance service. They were very concerned that we meant that that was just going to be about fining, and actually not recognising that some of the tools that we use is actually about unpicking those barriers and that journey for that young person just to arrive at school, particularly thinking about the young carer's day-to-day experience, for example. We ensure as well that we have an attendance representative at all EHCP discussions in terms of WSAT services. So actually what we're doing here is we're trying to make sure that we recognise any potential barriers to attendance for young people with special educational needs, particularly those that are talking about wanting IOSIS packages, those talking about wanting additional funding involved, or actually saying I want to come off roll from a special school and electively home educate. We're involved in all of those meetings to ensure that any attendance barriers have been addressed prior to such drastic decisions being made. We amended here as well what we call a triangle approach to legal sanctions. We don't jump straight to prosecutions here in Cambridgeshire. We will only go to prosecution if a penalty notice has been attempted first and has been unsuccessful. Our rationale for that was Cambridgeshire courts were incredibly booked up. It took many, many months, often 8-9 months before we were provided with an open court date, which was not proving successful. And we also had significant delays for SJPs as well. Our response to schools who were very frustrated and were seeing that this toolkit wasn't working was to use a penalty notice first, regardless of what level that attendance is, as long as we can see robust early intervention has taken place. It's been a very effective toolkit for us, actually. It's meant that we've been able to put something quicker and faster and seen effective results. We've also received positive praise as well from the Cambridge Magistrates Courts, who are thankful that actually the court cases we're presenting feel as if it is very appropriate, as all strategies have been tried, including alternative legal sanctions as well. We also incorporate a have your say, so we do not initiate any legal sanctions without having the say of the parent. Now, that's because we're not attending parent contract meetings with our schools. They take ownership and responsibility for that. So we want to still have an opportunity to hear what the families are saying. So we use on our portal an opportunity for have your say, and a parent is able to articulate what they feel the barriers were and the efforts that they have made. And that we feel that that helps us really to make an informed decision and us to intervene in a school. Perhaps we might identify a medical need or another more appropriate reason for why perhaps the attendance is so low. And this gives us another opportunity to advocate for that parent or ensure that relevant signposting and referrals have been made. So again, reducing the number of instances where we may find ourselves issuing a legal sanction and it has not been appropriate to do so. So since implementing that, we've seen a significant reduction in the number of PNs that have been withdrawn, and already received positive praise from schools about showing that much better, thorough and robust way of investigating legal sanctions before they happen. And that's it from me.
Perfect. Thanks, Billy. Again, so much hard work gone on by not just you, but by your seniors and by the rest of the team as well. And lots of positive cultural change happening in the connections with schools as well as the sort of service design stuff. Any questions or thoughts for Millie from the virtual room? I think what was useful, while we give people a moment to see if they've got any, I think what was useful really that I took from it in particular, and that had seen when we've spoken before, Millie, was just this connection between the sort of training offer of the local authority and the building the connections and the capability of schools to take on some of the work has then that has took a long time, hasn't it? And so you can't switch that overnight. So people who are sitting there and thinking, well, great, but my schools have got a long way to go before we could step back to that extent. You were there. And it just took you a long time to get to that position. So I suppose don't feel daunted is the point.
Yeah, absolutely. Yeah, it didn't happen overnight, but I think for us, it's if you can do just a few webinars, and that's the offer, that's what you're trying to convince them to do. By us not arriving inside your school for a cup of tea and a chat, we currently saved, when we calculated the maths, 468 hours were spent sitting in a car. Yeah. So part of us saying to our attendance officers, if we withdraw those 468, what can we do with that time? Yeah. Well, we developed a training offer for free is what we did with that time. Yeah. And that changed the dynamics in our school significantly.
Yeah, and that in itself is a good point that I've seen up and down the country for people who, particularly where you feel like you needed a growth bid and didn't get a growth bid in certain areas of the country. In terms of staff numbers, recognising that this is the total amount of staff I'm going to be given, but it's taking a step back and thinking, actually, how can I use the people I've got slightly differently, or how can we change things that we've done in the past to open up opportunities? Yeah, good point. Thanks, Millie. Right, question from Kathy.
Hi, I was really interested to hear about your NSA helpline and how you rolled that out and how that's so actively used, because that sounds great, especially if you've got GPs contacting you. And yeah, how did you get that off the ground?
Absolutely. So it has one person on a rota base, again, for their development opportunities as well, because you hear some absolutely balmy inquiries that come through. And so they can telephone and they complete an online form, and it will come through with a general bit of query for them. A lot of the time you can use standard phrases, so actually you don't need to spend masses of time, because many of them you can almost anticipate what they're going to be. And what we do is we ask them to double check if they've checked our Learn Together first, because again, we're encouraging that personal development and professional development. Go back and have a look on that portal. Are you sure it wasn't there? And we ensure as well that we have data that we come from that, and that's what we develop our communication strategy. If we look one term and we've had high queries about B codes, well then we need to have a communication strategy on our use of our coding because someone hasn't got it. So again, we're using our data to continuously think about our strategy. Same for our multi-academy trust. How many have we had come through? Oh, that many came through to us. Let's have a meeting with that trust. What's going on within them? So actually NSA does give you a first day response to schools, but the detail and intelligence you receive from that is incredibly telling. So it is definitely worthwhile both ways. To get it up and running in terms of your comms, you just promote that it's going to be same day. It doesn't happen overnight because, again, what you're trying to do is prevent them from going directly to an officer or person that they know. That person needs to be really firm and say, thank you for I've forwarded your email onto the NSA helpline who give you a same day response. And you're cutting them off from the source that they always go to and redirecting them to the source that you want to receive that information from. In terms of our promoting, we put it on all of our materials, but we were very strict in saying it's not for public, it's not for parents. And for parent contacts, we redirect to the contact centre. Okay, so again, we're redirecting to the conversation we want to be. In all of our professional meetings, whenever we delivered a presentation, we would have it on the bottom. On any communication, on any of our emails, it would be on the bottom. And the same for our YouTube channel. So anytime a professional calls us, they'll see it on the bottom. Constantly promoting our YouTubers channel that we've got, because what we're promoting is personal and professional development in everything that we do. So we're saying to the GPs, great, I'm glad you spoke with us. Did you know you can access a 5-minute sway on how Cambridgeshire combat medical needs for the residents you're serving? They were like, oh, okay, we'll ping you a link. So again, we're constantly referring to our YouTube because we find that for professionals, they've only got a few minutes. And we have an app here as well. So that's how we fix help for social care. They have a downloaded app and it's got everything to do with education on it for them. So that even though we've got a high turnover of staff here in the local authority or agency workers, they always have access to the most upcoming information they need. And if they've got a query about attendance or they've got a query about education, they open up their app, they enter a few keywords and it will pop up for them, including the link to the 5 Minutes Ways and our YouTube channel.
Super, thanks, Billy. Hopefully that some of that helped you, Kathy. Lots to take in there in terms of lots of different ideas. But I mean, a common theme in both Katie and Millie's presentations was that sort of offer of contact to schools. And obviously that's a core part of the guidance. Like all the core parts of the guidance, they are sort of clear expectations, but they don't say how you do them, because the point is that you develop them into a way that works best for your team, your schools, what you need. And so they've taken them in slightly different directions. One of the things that I think scared some people when they've been out and about in the country is just the fear of being bombarded with lots of different queries, as Millie says, from parents, but also from schools. So I think the lesson learned from both presentations there on that point is being really clear about when that's available, how that's available, what you can and can't provide through that, and setting that out rather than sort of allowing schools or allowing parents to demand too much of you if you haven't got the capacity to deliver that. So sort of slightly flipping it around a little bit and saying, this is what we are able to offer. Perfect. Well, thank you so much to both of the speakers, and thank you to everybody for being here. I hope, as I said at the beginning, that even those of you who've got LAs at very different contexts or at very different points of the journey to implementing the guidance took something or have been able to take something from it. If you didn't, because the contexts are so widely different, as I say, once we've recorded all of the sessions from each of the regions, we'll share them all as a set of them, and you'll be able to dip into case studies that more closely match your LA context, but from a different region. But thank you again to both the speakers. Happy New Year, everybody, and thanks for everything you're continuing to do. Bye.
Thank you.
Thank you.
Thank you, bye.